Okay, everyone, this is a voice over PowerPoint with a little bit of information about how we do pediatric medication dosing and why we do it the way we do it. Since some of you will not be having clinical until after our first test, this just gives us an opportunity to make sure it's something everybody can refer to and that you understand not only how to do the problems that we have in our math assignments, but also a little bit about why we do them the way we do them. So very briefly, when we talk about administering medications to children, um, infant and child dosages, when we read them, and if you start to look at what we may be giving as we go through the V simulations and you compare those maybe to what you may be given in the adult world, they will seem small. They will seem like very tiny doses. However, what's important for you to understand is that proportionately based on the weight of the child, the doses are much larger when we look at the amount we give per kilogram of body weight than we would for an adult dosage. So these children are getting technically a higher dose per body weight and therefore much more of that medication per their size than an adult would be getting. And there's a couple different reasons for that. So the first reason, when we look at young infants, so our newborn infants up and through that first year of age, they have a very large percentage of body water. And so they have a decreased ability to absorb water-soluble drugs. So drugs that fall into that category will necessitate dosages of these drugs that are proportionately higher than they do given to a person's of a larger size. So we proportionately have to do it because of the increased water content in bodies of young infants. When we get to about that 1 year to 12-year range, and if you look at packages of medications that are pediatric medications or adult medications that are approved, often that 12-year-old is that marker. So between 1 year and 12-year, when we begin to start to consider them more like an adolescent, they metabolize drugs much more readily and much more quickly than adults do. So we have to give them higher dosages per body weight because they'll excrete the drug, metabolize it, and excrete it much, much more quickly. Once children hit the age of about 13 to 18 years of age, they are often then going to be looked at, for the most part, certain drugs still may be separated, but for the most part, we're going to look at them as an adult in terms of the parameters we would use for dosing. So remember, there are some different reasons. And when we had our discussion about skin integrity as well, remember, skin is very thin. So if we do transdermal patching, they're going to absorb much more amounts of medications through the skin as well because of the growth and development of children and infants. So the other issue that we run into in the pediatric world is there is much less detailed information on the proper dosing for children. There really isn't as much research as we have on adult medications. And so it's really imperative that those individuals caring for young children really continuously and competently evaluate and assess our children for complications related to medications, side effects related to medications, and in some cases, adverse reactions to those medications. So we really have to not only ourselves be clued in, but we have to teach family members and caregivers also to be clued into those potential side effects. So when we medicate or provide medications and prescribe medications for pediatrics, the general rule of thumb is that medications are ordered in dosing per kilogram of body weight. So we have to convert our pounds to kilograms first and foremost. And when you look up in drug formularies for pediatric dosing, you'll see it as milligrams per kilogram. And so that adds an extra step to our work. So if our body weight is in kilogram conversions, what we have to think about is every 2.2 pounds is equivalent to 1 kilogram of body weight. We do need to know that conversion. You do need to have it memorized if you do not already. 1 pound is 16 ounces. Make sure you know that as well. I will tell you for NCLEX, it is really important for you to remember how many milliliters per ounce, how many milliliters per cup, how many ounces per cup, 8, So things like that are really important to know because you will be expected to know them on an NCLEX test. So when you convert your pounds to kilograms, always remember to convert to the nearest tenth or 1 decimal place. All right, and then we do the math from there. So let's look at our body weight method for medication calculations. So pediatric dosings are often written as so many milligrams per kilogram or within a range. So they may say normal range could fall anywhere between 3 milligrams and 6 milligrams per kilo per day. So the first thing we're going to do is determine that whatever is ordered as a dose, we are verifying is appropriate and falls within the safe range of dosing per the child's body weight. So the first thing we're going to do, if we only have pounds for children, then we need to do that conversion and round that to the 10th place for kilograms. So remember, 2.2 pounds per kilo, and we will determine then how many kilos the child weighs. From there, to calculate safe dosage, you may be doing it in milligrams per kilogram, micrograms per kilogram, but for a child, it's recommended to be in some sort of range. So what you're going to do is multiply milligrams per kilogram that's recommended by the child's weight in kilograms. And that makes sense. So we're going to see. So if I have a dose that is 3 milligrams to a range of 6 milligrams per kilo per day, when I'm trying to find out what would be a safe dose, I will calculate what would it be if it was 3 milligrams per kilogram per the weight and 6 milligrams. And my dose should fall somewhere in there. So then once you have that figured out, you're going to look at your ordered dose and does it fall within that recommended dosing range? And from there you decide if it's safe. If it's safe, you're going to go ahead and calculate the amount to give and administer to the child. If the dosage seems very unsafe based on those ranges that have been provided for you, then we do need to contact the health provider and prescriber for clarity on that dosing. So let's try one. So our order is for morphine sulfate, 1.8 milligrams IM stat, and the child's weight is 79 pounds. The first thing we also want to know is that the recommended dose for IM dosaging of morphine is 0.05 milligrams per kilogram per dose. So we know that that's where it should be initiated. And now what I need to find out is that 1.8 milligrams ordered stat appropriate and safe for a 79-pound child? So our first step is to take that 79 pounds and divide it by 2.2 pounds per kilo. And when we do that and multiply that out, we should get a total of 35.9 kilograms. From there, we will multiply milligrams per kilogram per dose, or in other words, that 0.05 milligrams per kilogram per dose, by that child's weight in kilograms, or 35.9. So you can see I have the math written there, 0.05 milligrams per kilogram per dose times 35.9 kilograms. When I do the math on that, I get 1.79 milligrams per dose. And from there, always round to the 10th, which becomes 1.8 milligrams per dose. Yes, that is a safe dosage. In fact, it's exactly what was ordered for my patient. And then I will calculate, well, what will I give that is equivalent to 1.8 milligrams of this morphine? Well, my concentration available to me is 5 milligrams per milliliter. So what I'm going to do is use my formula, desired over have times quantity, and that is 1.8 milligrams over 5 milligrams times 1 ml. And what that works out to be is 0.36 mLs of morphine to be administered to this child stat. And that 0.36 is equivalent to 1.8 milligrams of morphine per that calculation. Okay, so let's try one more. Or another way of looking at things, I guess. So first of all, routine around-the-clock drugs can be ordered as well. And the reason we may order routine or around-the-clock medications is to give that continuous effect on the body over a 24-hour period. We're trying to prevent those peaks and valleys of treatment. So when those drugs are ordered, they are usually ordered as a total daily dose. And then it will indicate in so many divided doses. So you can see it may say so many milligrams per kilogram per day to be divided into some specific number of individual doses. And it may say three doses per day evenly spread out, twice a day, 4 times a day, whatever the recommendation is. So it'll be so many milligrams per kilogram per day in 3 divided doses. It is imperative that we learn to carefully read the recommended dosing because they can be written as per dose or per day. So let's look at one that's written as per day. So cefaclor, 100 milligrams PO, 3 times a day or TID, and the child's weight is 33.5 pounds. So the first step I want to do is to calculate how many kilograms this child weighs. So remember, 33.5 pounds divided by 2.2 pounds per kilo. And that gives me, in tenths, 15.2 kilograms for this child. So now I'm going to use my 15.2 kilograms and begin to calculate how this dosing will be. To calculate a recommended dosage, cefaclor's usual dose is written as the following: 20 milligrams per kilogram per day in 3 divided doses. So, first step, how much is 20 milligrams per kilogram for a child who weighs 15.2 kilograms? So 20 milligrams per kilogram per day times 15.2 kilograms is 304 milligrams per day. That would be per day. And when I look at my normal recommended dosage, it says in 3 divided doses. So from there, I'm going to take my divided or my total milligrams per day per our standard normal recommended dose of 304 milligrams per day and divide it into 3 divided doses or divided by 3. And that will give me a recommended dose every 8 hours of 101.3 milligrams per dose. All right. So if the cefaclor order of 100 milligrams PO 3 times a day, we are right in the range of 101.3 milligrams per day. We are actually slightly under, and if this was me, I would probably speak to the ordering physician and say, is this what you want to do? Remember, we are rounding to tenths, but in general, this would be a safe dose for this child. So here is one more option for us. So if we order cefaclor 100 milligrams 3 times a day and the child's weight is 33.5 pounds, let's convert our pounds to kilograms. So 33.5 pounds divided by 2.2 pounds per kilo, and that equals 15.2 kilos. So then, as we said, we calculate the recommended dosage. So this is repeating what we have done above, and then we'll see what we would administer. What we found in this process in 3 divided doses would be 101.3 milligrams per dose. Is this dose reasonable? And as we said, yes. 100 is reasonably safe. For a dosage of 101.3 as a single recommended dosage, we are okay. To calculate one dose, cefaclor is available in 125 milligrams per 5 ml label. So now what I have to do is look at 100 milligrams PO 3 times a day, and my available solution is 125 milligrams per 5 mLs. So when I set that up over desired over have times quantity, I get 100 milligrams over 125 milligrams times 5 mLs, and that will give me an exact dose to be administered for the cefaclor of 4 mLs. I'm hoping that this has helped a little bit for everybody. Continue to practice these on the sheets that we've given, and your clinical faculty will continue to go over this information with you as well. If you have further questions, please always feel free to reach out to either any of your clinical faculty or myself, and we are very happy to help you.